Hello, beautiful people. Once again, my name is Dr. Maduako, and I'm coming to you from the video channel or YouTube channel of lastlongerng.com. And the essence of this video is to carry on with what we started with the first part, which is to answer your queries, which you sent to us via email, via comments on our website about how to last long, the various conditions you have, and how you could manage it in terms of being the man you are created to be. If you have a look at what you are seeing on your screen, you could see that these are questions or these are queries that were sent in by different clients, and we've decided to cover up the areas of privacy for us to maintain the privacy of the persons who are sending it in. But the essence of this video is so that you can benefit from exactly what we are saying, and you could learn from what we are saying and get some benefits from what we proffered as a solution to another man. So right away, we delve into where we stopped. And if you have comments, you could drop comments below this video. I'll be dropping links below this video that would take you deeper into lots of further explanations on the website. So you could see that these are queries. As I said, the first video, we had stopped at the client of ours who was currently on Zeloda and who was experiencing premature ejaculation, and he was losing his erection gradually. I started by explaining what Zeloda is. Zeloda is a chemotherapeutic agent. What we mean by that is that Zeloda is used for the management of cancer. So these are clients, unfortunately, is managing cancer, and he's equally experiencing premature ejaculation and is losing his erection. With cancer comes multi-systemic shutdown. What I mean by that is that with cancer, you tend to have shutdown of various parts of the body. You tend to have decreased blood flow to various parts of the body. And with decreased blood flow to various parts of the body, you could still have issues with erectile dysfunction. But what you can do is to increase your level of graduated workouts. What do I mean by graduated workouts? For you that it's on chemotherapy, nobody will advise you to begin to do a very strenuous exercises. What a walk, 10 minutes walk, 15 minutes walk, 20 minutes walk, as your tolerance increases, it's enough in terms of home workouts. 10 minutes workout probably in the comfort of your home or room, 10 minutes in the day, in the mornings, it's good enough to increase blood flow to other parts of the body. And you could still start on uh, penis exercises, penis enhancement exercises. And you can do that using the penis pumps, and you can equally do that using the DVDs which are on the website. In terms of premature ejaculation, I want to be clear that you are not masturbating, because that would be counterproductive to helping us achieve what we want to achieve in terms of being the man you were created to be. Excuse me. So, in conclusion, for our patient who is on Zeloda, who is experiencing premature ejaculation, and who is losing his erection gradually, number one, continue with your chemotherapeutic agent. That is exactly for the cancer process. That will equally help you in terms of managing what is at the root cause of having erectile dysfunction. Sometimes it may not actually be coming from the cancerous process. It may actually be as a result of a coexistent morbidity. What I mean by that is, what's your blood pressure, what's your blood sugar, how are these things doing? If those are okay and your fasting cholesterol level is equally okay, then you could go ahead and practice penis exercises. You can use the Vigo caps to jumpstart the process. But if your blood sugar or your blood or your blood pressure is raised, you need to control those ones. And if your lipid and cholesterol levels are equally raised, you need to control those ones to have very good effects in terms of lasting longer and being the man you are created to be. We have another client who talks about weak penis. Weak penis is akin to saying weak manhood. And it's more or less a very vague term because it has lots of branches to it. Sorry about that. If you say weak penis could mean that you are referring to premature ejaculation. It could mean you are referring to erectile dysfunction. It could mean that you are not able to sustain an erection, but you're able to achieve an erection. There's a difference between the two. Being able to achieve an erection means that you're able to have an erection, but you're not able to sustain it long enough to have a meaningful sexual intercourse or coitus, which means in that case, you could be having issues with anxiety. Sometimes you could be having issues with your vessels, equally as we mentioned. But whatever the cause of the weak penis is, you need to follow it according to the guidelines which we have discussed, which is number one, find out if there are baseline things that are affecting your penis, like high blood sugar, sexually transmitted infections or diseases, high blood pressure. Then, if you don't have any of this, inclusive of high cholesterol levels, you could start with penis exercises, the Vigo caps, the V-Swiss, the Vigrax. All that are structured to help you in terms of having a good penis and good erection. The more you exercise your penis, the more you use the Vigo caps, the more you see an increased ability for you to withstand sexual intercourse and stress. Then we go to the next one, which is premature ejaculation and coming too early. Now, coming too early is the same thing as premature ejaculation. Coming too early is a colloquial term for premature ejaculation. But what do we mean by premature ejaculation, and how do we combat premature ejaculation? The definition of premature ejaculation is relative. Relative in the sense that it's a wide range in terms of time. Even though you are not supposed or you are not designed to ejaculate before 2 minutes. Now, if you are ejaculating before 2 minutes, that means that I'm talking about 2 minutes of actual sexual intercourse. I'm not referring to 2 minutes of foreplay. Now, if you're ejaculating during foreplay, ejaculating before 2 minutes of actual sexual intercourse, then you are dealing with a problem of premature ejaculation. However, if you are lasting more than 2 minutes, but you are not lasting long enough for the sexual satisfaction of your partner, that is still relative premature ejaculation. Now, the management of absolute premature ejaculation is different from the management of relative premature ejaculation. For absolute premature ejaculation, that is where we talk about the baseline things, making sure that you are not masturbating, making sure that you don't have any coexistent morbidity, and then that is now when you can start exercising the penis, and that is when you can start using the spray. Remember, the spray is only to help you jumpstart the process. That is, I'm referring to different sprays. The one we have, we distribute for Nigeria is a stud spray. Those are to jumpstart the process while you are doing the things that could help you achieve maximal stamina and ability to last long as much as you wish. If you talk about relative premature ejaculation, in relative premature ejaculation, most times it is psychological. Another issue could be that positional. I'll be dropping a link to the website where we talked about the 4 stages of ejaculatory control. That is very key. In that case, you need to study your partner. You need to know how to lengthen whatever stage of premature ejaculation you find yourself. After the article, you'll be able to know at this stage, this is where I misfire in quotes, and this is where I come too early. Because it is mostly psychological in terms of relative premature ejaculation, you could solve it yourself by knowing exactly the 4 stages where you fall in. Another thing you could do, it's a very big secret. Something as simple as chewing gum can help you in terms of lasting as long as you wish. That is for relative premature ejaculation. And remember, I explained relative premature ejaculation as being the fact that you are not able to sustain erection, and you're not able to sustain ability to stay on for the satisfaction of your partner. Which means even if you stay for 3 minutes or 5 minutes but your partner is not satisfied, that is still relative premature ejaculation, because the essence of sexual intercourse is for mutual satisfaction. Sorry, excuse me. So we go to the next one. The next client is asking, he lasts from 5 to 50, or sorry, he wants to last between 5 to 15 minutes. And that's exactly what I've explained. If you are lasting less than 2 minutes, you have absolute premature ejaculation. More than 2 minutes, but not good enough for your partner, then you have relative premature ejaculation. The management of the two is a little different. And to recap, management of absolute premature ejaculation is stop masturbation, taking the foods that are necessary to encourage lasting longer. I'm still going to drop the links there. Some of them could be something as simple as watermelon recipes. Another thing you could do, you practice penis exercises. Remember, don't turn it into a masturbating episode. The link is there too. Another thing is you could use the sprays to jumpstart the process, not to be dependent on the sprays. Because if you are doing the baseline things right, you shouldn't use more than 2-3 sprays, because the sprays are not designed for you to depend on them. For absolute premature ejaculation, knowing about the 4 stages of ejaculatory control is key, and solving your problem and knowing where exactly to stop, where exactly to move on. The link to the 4 stages of ejaculatory control is still on below this video. Then I move on to the next client who talks about weak erection and premature ejaculation. Much the same thing we'll be explaining. All the key things we'll be explaining are still the same things. I'll pick on this. He says he wants a drug to help his weak erection and last longer. Just like we've been explaining, the drugs are there, the Vigocap, the Viagrax, the V-Swiss. All these are medications for you to remain strong, last longer, but you must be doing the things that should set the precedence. If you don't do the things that set the precedence, you'll be dependent on these drugs. And that is why you see some men, they are not able to perform if they've not taken the Viagra or whatever medication, because the basic things, they are not doing them. What are those basic things? You must know that your blood sugar is within control. You must know that your blood pressure is well controlled. You must exercise your penis. You must do home body workouts to increase blood flow all over the body. You must eat the right foods. Eating the right foods, summary: portion size reduction. And when I mean portion size reduction, I'm referring to portion size reduction at once. Aside that, making sure that you have at least 4 hours between bedtime and when you go to, between bedtime and your last meal, which means if you are going to be sleeping by 10, your last meal shouldn't be later than 6 p.m. Why do you have to do that? To allow the body process the meal, to allow the body control your blood sugars better, to allow blood flow. When you wake up in the morning, you do your penis exercise for 10 minutes, you do your home body workouts for another 10 minutes, you take your shower, and you're good to go for the day. In that way, consistently, you begin to increase blood flow to all parts of the body, and especially your manhood that you've been exercising. Remember, as you are doing this, you're taking the Vigocap, and as time goes on, you notice that you are not going to be dependent on the Vigocap or the Viagrax or the V-Swiss, because they've done their job on a fertile ground, which is to jumpstart the process where the ground is fertile. If the ground is not fertile, your blood sugars are not controlled, you are masturbating, your blood pressure is not well controlled, you have high cholesterol levels, nothing is going to happen. You're going to be dependent on those drugs. Anytime you stop taking the drugs, you don't see any result, you don't see any effect. So he talks about premature ejaculation. I've explained that. He talks about hypertensive. I've explained that. He wants to consult with me. That's exactly what I'm doing now. I've asked the secretary to compile all these questions while I speak to everybody and large, so that persons who didn't even send in their queries can learn from what we are discussing. Okay, we move on to the next slide. All right, it's still about the same thing: premature ejaculation, coming too early, premature ejaculation, coming too early. He wants up. Okay, let me take on this. I'm sorry about this, but this is everybody who writes to us, who sends a mail to us. It's all private. And remember, what we are doing, we are helping out everybody who has this, because you go to your clinics, you go to your doctor. I was practicing in Nigeria before I moved to the UK, so I know exactly what it means to practice in Nigeria. I know what exactly it means to practice in the UK, and I practice medicine in both climes, and I know what I'm saying. What I'm saying is, in the Nigerian context, most times, most doctors don't have your time to for you to ask questions about penis enlargement, or lasting longer in bed, or situations like that. But what we provide is an avenue where you can get to us. We listen to you, not just give you medications, not just give you drugs. Can we give everybody the same drug? Why are we giving Viagra to Mr. A, to Mr. B, to Mr. C, to Mr. D? However, the situations for Mr. A is different from Mr. B. Mr. B may be hypertensive, Mr. A may be diabetic, Mr. B may be on other medications. The essence is to review whatever situation you have as an individual and treat you as an individual. So whatever we do, we make sure that we cover all areas that relate to your privacy. And that is why you could see that this axis actually has names, actually has issues, but we try to make sure we cover all axes that have to do with that. And we do that to make sure that nobody's name, nobody's details is exposed. So you could feel free, send in your comments, drop your comments below this video, and I'll be there to answer all queries you have. I'll be there to address all issues that have to do with premature ejaculation, lasting longer in bed, low sperm count, problems of being the man you were created to be, inability to father a boy or your girl, whatever the issue is. Talk to me, talk to us, lastlongerng.com, and we'll be there to discuss with you. Do one thing that's very important: subscribe to this video, comments, make your comments known, spread this video to your friends, relatives, who you think would benefit from this. And I'll be there with you once more. Next time we'll have our channel open and we'll be delivering a video. Once you are subscribed, once a video is published, you'll be able to see that. Very soon, before the end of the year, we'll be holding a consultation in Nigeria where you could see me one-on-one, and I'll be coming with other sexual specialists, and we'll be in Nigeria. Precisely, it's going to be in Lagos. I'm sorry about that if you stay in other parts of the country. However, it will be telecast live to other parts of the country so that you'll be able to come in here live via Skype and discuss, and we profile solutions to whatever challenge you are having. So it remains Dr. Maduako. I've been with you, and this video is the second part of a two-part video. The first part is usually on our YouTube channel, and you could see other links that are below this video to other parts of the site where you could learn more and get yourself informed, get yourself solutions, and be the man you were created to be. Thank you once again for listening in and watching, and I'm grateful. All the best. Bye. Cheers.